Okay, we're live now.
All right, appreciate it. I'd like to call this pandemic and natural disaster. Is that what we call it? Natural disaster ad hoc subcommittee meeting to order. Mr. Clerk, please call the roll.
Commissioner Jackson,
Here.
Commissioner Watts, Gage Watts, Commissioner Epperson,
Yeah.
Commissioner Young, Commissioner Johnson. Commissioner Johnson, I see you, but I didn't hear you.
Present.
Thank you very much. Okay, you have 3 of 5 members present, and you do have a quorum. Also, Commissioner Lynn Cawthorn is also on the call as well.
Okay, great. Let the record reflect that Commissioner Cawthorn is on. We'll have our invocation if Commissioner Epperson doesn't mind, and then I'll lead us in the Pledge of Allegiance, and then we can go from there. Commissioner Epperson, you mind doing the invocation?
10-4.
Okay.
Please bow. Our Father who art in heaven, hallowed be thy name. Thy kingdom come, thy will be done, on earth as it is in heaven. Give us this day our daily bread, and forgive us for our trespasses, as we forgive those who trespass against us. And lead us not into temptation, but deliver us from evil. For thou art the kingdom, the power, and the glory forever. Amen.
Thank you, Commissioner Epperson. Would all veteran and active military members salute during the recitation of the Pledge of Allegiance if they like, and all others can just repeat to themselves. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. All right. Thank you, Mr. Clerk. Next.
Sorry, I wasn't quick enough to get unmuted.
It's all good. We're moving pretty fast.
That brings us to agenda additions, where we would need a motion to approve the consideration of the items under Louisiana Revised Statute 42:17.1.
Okay. Are there any agenda additions at this time that you received?
I'm not aware of any.
Okay. Any members have anything they want to add to the agenda? Okay, I think we're good. I'd like to make a motion to approve consideration of items under Revised Statute 42:17.1 by unanimous consent. Is there any objection to approving that by unanimous consent? All right, Mr. Clerk, that is approved by unanimous consent.
Thank you very much. And then at this point, I can just draw your attention to the certificate of teleconference that's attached. No actions required. But that brings us to public comments. So now we have received one electronic public comment in advance of the meeting. And if you'd like, I can go ahead and give the phone number out for any telephone comments and then read that comment.
Go right ahead.
All right. That phone number, if anybody should want to make a public comment, is 318-226-6596. Again, 318-226-6596. And I will share the public comment that we received electronically at this time. This comment comes from Mr. John Settle. It says, I understand that many African Americans in Shreveport have expressed a reluctance to be vaccinated for COVID-19. I also understand that many citizens in Caddo Parish are homebound and have difficulty in obtaining the vaccinations. Shreveport Council member Tabitha Taylor and Dr. Tanya Clayton are working to establish a homebound vaccination program. I think it's important to educate all citizens on the science versus the scuttlebutt on these vaccinations. Focus SB is ready to provide maximum publicity to assist the COVID-19 vaccinations programs as part of its mission to build a better community with positive local news. Please advise when and how we can help, from John Settle. And
any other body call in yet?
I do not see any calls. Michelle, have you received any? No. Okay. No, we've not received any calls. You want us to go ahead and move on with the agenda?
Yes, sir. Next order of business.
That sounds great. We're at new business. The first item under new business is a public health update.
Yes, thank you, Mr. Clerk. And I just want to open up real quick by just saying this is sort of a briefing that we would like to do. We want to at least try to aim for at least maybe once a month. I don't want to I won't want to occupy folks' time every week doing a briefing update, but we do want to remind the public that we are still in the middle of a pandemic. Although we're sort of in the phase of trying to get shots in folks' arms, there's still another aspect where we have to continue testing. We have to continue to mask up. We have to continue to social distance. So we do want to continue to let our community, as well as the community leaders in the Caddo area, know that we're still in the middle of a pandemic. Things we hope are getting better, but we want to be led and guided by the numbers, and we also want to be guided by the science. And so this we want to use as a forum to get out accurate information from public health experts and leaders in that area. And we want to be able to use this committee as a forum and tool to do that again. So I want to thank everybody for joining us, and we'll open it up for Dr. Martha White at this time. Dr. White, if you could, we would just like to have maybe a general update from public health at this time, where we are. Is our test positive rate getting any better? Are we looking worse? What are our ICU bed situation looking like? Is there anything from your end that you would like to provide as it relates to community testing or community vaccination? So I'll open the floor up to Dr. Martha White at this time. And then from there, I'll turn it over to another community partner. Thank you, Dr. Martha White.
Sure, thank you. So we are actually looking better, which is good news. However, we are still not good. So when I say we're looking better, at our worst for this last big wave of cases, we had well over 375 people in the hospital. I think we were up to over 380 was our high. And we are now down to 204 last night, which is wonderful. My only hesitation when I talk about those numbers is I want everybody to understand in this region, when all of the other regions, kind of dropped their cases and we saw that end of phase 2, remember in the end of the summer, and we, everything got better and we thought, oh, good, we've kind of come through that big wave. New Orleans and Baton Rouge, their hospitalization rates were around 40 people in the hospital with COVID every day at that time. We up here never dropped below 160 to 180 a day with COVID. So it's very important that we keep pushing, that we keep doing all the mitigation factors, we keep testing, we keep quarantining and isolating, so that we want to get our baseline in hospitals as low as we can in case we face another wave. Our highest case number in the hospital as we went into this third wave had been 199. And we got, almost doubled that this last wave. We don't want to start at, 190 as our baseline and then start climbing. So we want to keep pushing. We're seeing a good drop in our cases in the hospital. The hospital is feeling some breathing room. We do have, beds in our ICU. We do have ventilators available. Our deaths are still, we're still seeing a fair number of deaths. However, that always lags a little bit behind. So that's not surprising. Our percent positivity for Caddo Parish for the first time in, I can't remember when, we're below 10%. Woohoo! So we are 8.3% this week. That's amazing. That's really good to hear. Now in our children, we're still seeing it goes from 5 to 17, I think. That percent is higher. It's up around 14, 15%. So we know, kids are playing sports, they're having gatherings, and we worry that they're bringing it home to people who are higher risk. So I do just really want to stress that while we are seeing improvements, it's not the time to, take our foot off the gas. We need to keep really pushing, doing a good job. And I'm, starting for the first time in almost a year to feel a little bit positive. It's been almost a year that we've been doing this, all of us. So now, as far as testing, we do need to encourage people to test. I think a lot of people have fear over, I don't want to get tested, I don't want to know. I might have to quarantine. It's really important for you to know for a couple of reasons. A, you don't want to take a virus that could maybe deadly to you, but also could be deadly to people at the grocery store that you don't know, but even more importantly, like in your church or in your family that you do know, and may cause significant illness and even death. So that's the first and primary reason to test, is so you know how to protect yourself and others. The second reason is if you do test and you have a positive test, it does help you it prevents you from not having to quarantine for 3 months if you're a close contact to someone. So knowing that you've tested positive, knowing that you've had it, CDC gives you 90 days after you recover before you have to quarantine again. So it does protect you actually in the long run from being a close contact that might have to quarantine. So I do hope that we encourage people to test, not be afraid to test. We are testing, sir, I don't know if y'all know this, but we are testing in our health units. So as well as there's a lot of sites that offer rapid testing. No place should charge you for a test. So if you are being charged a visit, if you are going simply to get a test, then please let our office know, because they're not supposed to do that. Same with vaccinations. If you get a vaccine, they can bill your insurance for an administration fee, which is actually, I think for both shots, they only get $22. But they cannot bill you for a visit. They cannot charge you anything out of pocket, and if you don't have insurance, they cannot turn you away, and they cannot make you pay. So it's very important for people to be empowered about that. If someone is trying to charge you, please let my office know, let the commission know, let someone that can get it to me so that we can address it, because we can remove vaccine from them, so they cannot be providers if they're not going to follow the rules. They are not supposed to be a fee for COVID vaccine. Now, supplies of COVID vaccine, let's talk about that, because that's a huge issue. When we first started with vaccinations, we first got Pfizer. And Pfizer, because of its storage requirements, went only to hospitals. And then there were a couple of large pharmacy chains that had the ability to do some storage. So there were some regions in the state that didn't get as much vaccine offered to their parishes because they didn't have large hospitals. So for the last couple of weeks, they have really cut supply to the regions that have these large hospital systems, just to try to equal out for those regions that did not get maybe their fair share the first few weeks. So for example, when I did my allocations for vaccine for this week coming up, so what happens is on Monday, we get a list of people who've requested. We get a list of people who are also ready to receive. And then we get the number of doses we have coming to our region. And we try to make sure it goes out, and it goes out and we try to spread it among neighborhoods and areas so that we can get it into as many communities as possible. For this week, where I got my allocation sheet, I had 4,000 doses 4,200 to be exact, for 9 parishes. That's just nothing, right? So next week, that where they had cut us so that they could try to equalize it in other regions, that ends. So hopefully next week we will see our allocation rise again. Plus, on top, we're being told we will get more vaccine into the state next week. So I'm hoping we will see some improvement. Nobody's happy. Let's just be honest. I get calls all day long, every day. Everybody deserves this vaccine. Everybody does. Everybody has a reason why their group should be prioritized, and they're all pretty much right. It's just, there's just simply not enough vaccine in the state to do that. A lot of people ask me about teachers, and I can't for sure, I can't speak for the governor. I don't know exactly. All I can say is that's a very large number of people when we talk about school districts all across the state. So if I'm saying we got 60,000 doses into the state, and you talk about all the school district staff around the state, that might be the entire 60,000 doses. So I think it's simply that he's trying to get enough vaccine in the state to be able to move into that tier and be able to cover them. He values teachers, he values bus drivers, and all of the staff in school districts, all of our essential employees. For government workers, I know I've talked to the gentleman from Sportran a couple of times. His people deserve it. They do. I mean, I get it. So we're just waiting for that allocation numbers to go up. And I am hopeful we are seeing some increases. So just to give you an example, we only had approximately, I think we had 2,000 people ready for vaccine, 2,000 sites that wanted to receive, and only 378 received across the state. So that just kind of lets people know where we are in that fact that it's difficult. People ask me a lot about if I know you can tell me if I need to shut up, Stephen, if I'm saying too much. But people ask me.
No, this is great. Thank you. This is
people
great.
ask me a lot about the drive-through at the fairgrounds. That came about very organically. Dr. Van Cherry at first got some doses. He decided to do a drive-through, and it went great. He, however, he's with the medical school, not being associated with a hospital, he did not receive vaccine the next week. At the same time, the governor said hospital systems could not exclude people when they gave vaccine to the community. So it had to be anyone. It couldn't just be someone in their system. So Christus looked at Dr. Van Cherry and said, hey, how about if we send some staff and give you vaccine? And then that could be our community outreach, because it's easier. It's very difficult to bring a large number of people into a clinic setting. Mm-hmm. You know that, Mr. Jackson. I know with David Rains, I was talking with Mr. White the other day. It's difficult. Right. And there's only so many people you can bring through your doors that way a day. And then once Christus donated their vaccine and their staff became a partnership, then Willis Knighton did the same. And to be honest, y'all, that's how long has it been since we've seen all them work together? So what a good thing for them to come together for our community. And they've done, just in that site alone, over 10,000 vaccinations, and 33% have been African American. So I was happy to hear that number. It's higher than I expected, but that's good to hear. We hope we can improve on that. Transportation is an issue. I was happy to hear Mr. Settle say about homebound and looking at ways to address that. That's an issue. We do have strike teams that we have available. We're just waiting for vaccine to be able to do that. We've been asked about, can we move and do some other drive-throughs in other areas? We did do one at Galilee Baptist. We have gone to Canaan Towers and another 2 I can't think of their names, retirement centers for people who are not able to really get out. Those were very successful. I think we did over 400 at Galilee. And we hope to be able to keep doing more. They're in Mansfield today. They did 400 some odd doses in Mansfield. So, we want to get to both rural and urban sites. We want to look at, everybody who has need. And, the goal is ultimately to get it into doctor's offices where patients can go to the docs that they know and they feel confident and comfortable discussing it with and get it that way. We're just not there yet.
Okay.
That's kind of all I had, Stephen. If there's any.
Doc, I think that was very thorough. And like I said, I want you to just know that this is a forum where you don't have to feel rushed. And this is a forum where you don't have to feel undermined. So I appreciate a thorough update like that, because we want to be guided by those level of facts and science and data that you have, because we don't have them and we don't have access to them. So it is very refreshing to hear the update that you provided. So thank you. I know in a while you have to run off, but looks like I have a question from Commissioner Epperson.
Sure.
For you, Commissioner Epperson.
Yes, sir.
Okay.
Ms. White, have you availed yourself to the Shreveport Sun relative to an interview of the nature which you've disclosed to us?
I'm sorry.
Have you availed yourself to the Shreveport Sun newspaper, where you could get an interview with the information you shared with us?
So, I have not reached out to them, to any media directly. I'll be honest, Mr. Epperson, I cover 20 parishes right now. And so it's all I can do to do meetings and calls and emails. And if they call me, I'm happy to speak with anyone. If you feel like that is someone that we should speak with, I'm happy to do that.
That's fine. Ms. White, maybe if you have a printout or something, you could send with me and we'll go from there.
Yes, sir. Or you can have them just reach out to me through email or call me. I'm happy to speak with them. It's just really hard for me to
that's
think.
That's what I'm talking about.
Yes, sir.
Do me a favor. Would you text me, email me your contact information, and I'll get it to them?
Sure, absolutely.
Thank you.
Yes, sir.
Any other questions for Dr. White? And Dr. White, maybe if you want to talk to Dr. Wilson to have our PIO help formulate, or if you have somebody in the office and you want to get that one sheeter, and we can probably put a infographic together to probably put an infographic. I know a lot of people may have reading fatigue about COVID-19. So maybe,
So is there, Stephen, if there's a few specific things that you think people would want to know the most, I'm happy to do that and then just update it weekly. Like, where we just keep a running thing. That's a lot easier than trying to write something out every update it.
I think probably what you mentioned about staying staying vigilant in the community, even though I wouldn't necessarily say even though things are looking better, I would just maybe keep it as general as possible. Then maybe the testing, the need for continued testing and being vigilant about why you need to go ahead and get tested and not being afraid to get the test, and just maybe some generic information on the vaccine specifically targeted to the African-American and homebound individuals. And then probably maybe if you have it that for that week, maybe a schedule of where people may be able to get the vaccines from for that week. And maybe they can just update that infographic weekly and share it with media partners. I remember when we were doing the testing very early on, when we do the testing, we would just send it out to the media, and the media did a very good job at informing the public in the morning and at night on when they could go get that test. So I'd imagine just something like that. And again, I'm volunteering Dr. Wilson to ask the PIO to help formulate that information, because you are covering 20 different parishes in Region 8, Region 7.
7 and 8 right now.
Oh,
Unfortunately.
wow. Okay, so you're in northwest and northeast.
I've got the whole north part of the state.
Okay, God bless you. So if we can lend that hand to you, I can't speak for Dr. Wilson and the PIO, but hopefully that's something that they will consider helping you put the message out, at least to Caddo Bossier region.
So can I ask you a question? Do y'all have y'all heard of course we know the cultural background for hesitancy on anything with experimental issues with the African-American culture, that's well understood. But is there specific hesitancies that people have verbalized to y'all, or if y'all know of that, if you'll share it with me, because we are trying to get little infographics out about the safety. It's probably one of our safest vaccines we've had. It's got no preservatives. It's like 98% effective. I mean, it's just a really good vaccine.
Doc, I can tell you, my uncle would not even take a flu shot, but he has gone to get this COVID vaccine.
Wonderful.
And
Yeah.
so he is of that era. The only disparaging comments I hear comes from people who are my age and younger, who probably don't know what they're talking about. And I mean that in
the best way. I understand.
Yeah, but
Yeah.
they're probably just not versed in it, and can be a little cavalier because of age. But the response that I'm seeing from the senior community in the vulnerable age group, they seem to take it more serious. They seem to be well studied on the issue. And
one thing I'll just put out there for y'all to put out when you're talking to people or you hear people being cavalier. My daughter is 20. One of her dear friends' brother's girlfriend. So she's 22, and she has lost one leg and is about to possibly lose her second leg to COVID.
Wow.
I have two 19-year-olds that I know of who have lost their lives. One is a good friend of my dear friend down in Lafayette, and another one's a good friend of ours over in Ruston. We've had over 100 children hospitalized with that MISC, the severe form of COVID. About I can't remember exactly, but close to 18 here. And the concerning part to me is all of them are African American in our region, not across the state. There is more variability across the state, more diversity across the state, but in our region, almost all of them with that severe form are African American, and that's concerning to me as to why. But I do want people to pay attention and realize that children are not immune. They can be very sick. And there is now something that we're learning that is a post-COVID syndrome, where people who were not even hospitalized may have just had like a mild flu-like illness, are having long-term neurologic effects from COVID, from brain fog, what they call, to severe fatigue, to endocrine issues like hormonal issues, to nerve damage, as well as pulmonary damage, months out. So this is not as benign an illness as I think everybody is writing it off to be. And then the variants that we're seeing, they are, the one in Brazil, they're seeing that in people who've already recovered from COVID. And it is much worse in those that have had COVID recovered. get this strain. They are sick down in Brazil. So we don't want to see that get here. But, it's just something we all need to really realize it's here. It's not going away right now. We need to do everything we can to protect ourselves and not be as as we all see everybody being, oh, I'll be fine, Yeah.
Well, Commissioner Cawthorn, and then we'll go to our next guest on public health. Commissioner Cawthorn.
Yes, sir. I wanted to ask Dr. White a couple of questions. I had to step away, and she may have gone over these. The first question would be, is there a process for persons coming out of from the state, any coordination with the governor's office to go out to assisted living facilities where there are people who are typically 65 and up? If so, how does one make an arrangement to have a conversation about it or to schedule on-site vaccinations for the seniors?
So initially when we looked at long-term care facilities, nursing homes like skilled care nursing, which is not assisted living, or retirement homes, that was set up with people going in from Walgreens and CVS. Unfortunately, they did not include assisted living or retirement homes in those groups. There is a number where they can call. I think a lot of groups have been successful in getting some of our private pharmacies. I think Albertsons has been good. And there's a number you can call, which I can try to email to y'all. I'll email it to Dr. Wilson and see if he can get it out to y'all. Where that group can call and try to set up with some individual pharmacies to see if they would do that. It's been successful for some people. It's not been successful for others. If they're still having issues and they cannot find it, the reason why they didn't include them is because they, a lot of those people have the ability to travel and get around. They have family around. They have ability to move more. And so they're assuming that they can go the same route as everyone else, but that's not always true. So
yeah, there's a particular housing unit in my district where there's a significant number of people there who don't have transportation.
So if you'll just, I'm going to put my email in the chat. If you'll just email me, and then we can talk about some options. It may be that we can send somebody. It's awful hard because once you start that, then the floodgates open, and there's a lot of people who need it. And but let email me and let's chat about it.
Okay, thank you very much.
Yes, sir.
All right. Well, thank you, Dr. White. I know you might have to run off, so if you have to log out, feel free. But again, we want this to be a safe place and a free exchange where you can come and share expert level subject matter numbers, because we don't want folks out there just saying things off the cuff. And we want to be guided by subject matter experts, data, and science. Our next guest will be Mr. Willie C. White from one of the finest, if not the finest, FQAC. I can say that now without having an ethics violation in this region. And so he will come and talk to us about their role and the work that they're doing related to COVID-19, specifically some of the work that they have coming up with community vaccinations. Mr. White.
Thank you, Commissioner Jackson. Good afternoon to the commission members and all. Thank you for the opportunity. I thought you were going to say one of the finest in the state, not just the region.
I give that to you too.
We want to make sure we say that. And Dave Range Community Health Centers, I say we are part of the effort to get the vaccines out into the community. We cover 4 parishes in the area. In addition to Caddo, we have Bossier, Webster, and Claiborne Parish as part of our service area. I'm very pleased to say that To date, we have administered approximately 3,200 first dose vaccines to individuals. And we're currently in the process of delivering the second shots to those 3,200 individuals that we have provided those first dose vaccines to them. Dr. White mentioned the challenges of getting the vaccine out into the communities. As a primary care provider in a community health center, we've had to essentially alter our operations to be able to hopefully effectively and efficiently deliver the vaccines. We have implemented vaccine days or vaccine only days within our clinic operations. And we've also implemented Saturday vaccine only days where we've been able to so far on most of those days vaccinate in the neighborhood of about 150 individuals during those efforts. And so right now, as I said, we're in the process of administering the second doses. And we continue that process of having days during the week that are vaccine only, and also Saturday vaccination clinics. This Saturday, and again, these are second doses. These are not first doses. These are second doses. All these individuals would have appointments and have been scheduled after having received their first dose at our facilities. And so this Saturday at our Shreveport facility on David Raines Road, we'll have a vaccination only clinic. And we have about 150 people scheduled for this Saturday to receive their second shot. We are planning, and we're gonna, they say, imitation is the highest form of flattery. So we are planning some drive-through second vaccination events. The first one is scheduled for the 20th at the Bossier Mall, and we're hoping to vaccinate 350 to 400 people on that day with their second shots. We have a second drive-through that we're planning for the 26th. That is presently scheduled for the St. Vincent Mall, where we hope to duplicate that effort and be able to vaccinate 350 to 400 individuals with their second shots on that day. Then on the 27th of this month, we'll have a vaccination only clinic at our Minden facility, where we hope to vaccinate 150 more for their second shots. Dr. White also mentioned testing. We are pushing testing in North Caddo this upcoming week. Hopefully the weather won't be an impediment to that, but on next Tuesday and Thursday, the 16th and the 18th, we're gonna be pushing free testing for COVID to continue to try to get people tested. Dr. White also mentioned the supply of vaccines. We are hoping to have another supply of first dose vaccines. And let me say, we had the Moderna vaccine, and we will be attempting to put those orders in to see how many vaccines will be available for another round of first shots. And so we are waiting now to see what, if our order will be filled so that we can start another round. But we have been very actively involved in this since the beginning of January, and we continue to do that. And we certainly appreciate the support of the commission and all those who have supported David Raines over the years. We've been in this community for many, many years, and we continue to be a part of the pandemic response as well as we work with the EOC when they're emergency responses. And so we are trying to do our part to get testing and vaccines out into the communities. Of course, we serve a large proportion of underserved communities as a community health center, and we're encouraging persons in our communities to get out and get the vaccinations. I would say I don't have specific demographic information. I only have anecdotal information, and that is we have experienced what Dr. White and others have alluded to, and that is we're seeing some resistance, particularly in the African American community, to get the vaccine. And so if I were to look at our numbers, it has been predominantly not African American. We're seeing that number start to close somewhat. I think we were more like 70-30, maybe 60-40 in terms of African American to non-African American, and we're hoping to continue to close that gap. We are certainly the vast majority of our patients are African American, and we're certainly pushing that to all of our patients, sending out information to them, encouraging them to get the vaccine. And so we are hopefully, again, being an integral part of trying to vaccinate our communities and stem the tide with the COVID virus. You have to answer any other questions or?
Hey, Mr. White, can I ask a question, please?
Yes, sir.
So the citizens are to contact you directly for an appointment?
Yes, we have an appointment line that we've set up for that purpose. I can give you that number, 318-227-3354. That's 227-3354. You can call that number to get an appointment. What we're doing right now, we've set up a waiting list because we don't know when we're going to have the next round of first doses. And we're encouraging people to go to our website and register. You can pre-register. If you go to our website at David Rains, CHC, excuse me, and go to the COVID-19 tab, and there's a registration. You'll see a vaccine registration form there. If you log on to that, okay, fill that information out, and then we will use that as our waiting list for when we get the next round of vaccines. You also see on that website, if people are interested, a person interested in getting testing, they can also register for testing. We're trying to make sure we make ourselves accessible, again, through that appointment desk, as well as online registration for vaccinations and testing.
Okay, thank you, sir.
Mr. White, I know President Biden talked about utilization of FQHCs. Is that something that's just underway right now? Is that something that you all have commenced in doing with the new administration in administering vaccine rollouts?
Yes, the new administration just recently announced that starting next week, their plan is to ship vaccines directly to community health centers around the country. At this point, we don't know which community health centers will be the first to receive those vaccines. Certainly, we don't know which community health centers in Louisiana may be the recipient of those direct vaccines. So that is still unknown at this point. Our vaccine supplies are coming through the state. And as Dr. White mentioned earlier, we put in an order or request, and then those vaccines are distributed based on whatever they've decided in terms of how to distribute those and how many get distributed to an area. We're hopeful that that's going to help with getting more of the vaccines, particularly in the underserved communities, which is part of the Biden plan, is to try to address the inequities that we're seeing in terms of who's receiving those vaccines.
Okay. And I know we reached out and we had some conversations. I don't know. I see Director, Homeland Security Director Robert Jump is on. Robert, did we have any success with getting National Guard or anybody want to with the upcoming events? Is everything good to go there? Is there anything that you all may need from the parish? I know we've done signage before. So Mr. White, if you can think of anything else, let us know.
Yes, I appreciate that. We will accept all the help we can get. We have, as of the day, I did talk with the Colonel, and he's indicated that the Guard should be able to support us for the drive-through events. We're also reaching out to Dr. Van Cherry to see if there are opportunities to utilize the setup at the fairground. We know that there are occasions where it may not be utilized, may be underutilized because they run out of vaccines. So we want to take advantage and be a good community partners with all of the healthcare facilities to make sure that we're getting these vaccines into arms. So I want to thank Director Jump for his assistance, and we'll continue to communicate.
Okay, I appreciate that. And any other members have any questions for David Raines, Community Health Centers? Robert, I'm sorry, did you have anything for us, Robert? I'm sorry.
I had taken it off of mute and then have to put it back on. But I'm happy to help out with the David Raines operation, and if there are any pitfalls as it goes forward, please don't hesitate to reach out again, and we can try to solve these problems.
Appreciate
We
it,
appreciate that.
all right, Mr. White. Well, we appreciate you, and we'll be hopefully we'll be sharing this information on our website and pushing it out about the vaccine, as well as sharing the website link. I believe we can link that website to our website, as well as share it on our social media apparatuses. But again, I don't dictate to the PIO. That's something that Dr. Wilson would have to give his stamp of approval to get that done, as well as share that phone number for folks to register. And I would suggest the same as to Dr. White, is if we could help you with the marketing and outreach. I know all of us have constituents, and one of the things that I've seen in DeKalb, and so I believe it was Gwinnett County, where they really leaned on those elected officials who represent those communities, particularly the underserved African-American community. They really leaned on those elected officials to help coordinate and get the word out about vaccines, so they can get their African-American vaccination rates up. So if that's something that we can work on, let us know.
Thank you very much. We certainly appreciate the support of the commission, and please don't hesitate to call on David Raines Community Health Centers at any time.
Okay. All right. Thank you. Thank you, Mr. White, and we'll continue. Mr. Clerk, next item do we have?
So the next item, I'm not sure if we sort of covered that topic already of the outreach to African-American communities.
Correct.
It was discussed, though.
We did. That's it. That's why I was saying yesterday, it's pretty much all the same. It was all.
Yeah, I kind of all blended together. So that
Yes, sir.
next item on our agenda then is the Caddo Homeland Security update.
All right. Thank you, Mr. Clerk. I see Sheriff Prater and I see Robert Jump. We'd like to just say if there's any in general Homeland Security update at this time, and then we'd also like to have a discussion about implementation of the threat assessment level that was passed with regard to Resolution 56. So Director Jump or Sheriff Prater, if y'all would like to just provide a generalized update. Good to hear or see from you, Sheriff Prater.
Well, it's nice to see you. Thank you for the invitation. I don't really have a lot to say because I'll leave it up to Robert to fill you in, because he knows more about the specifics, and it'd be much more interesting to hear about the specifics than what I'd say. We're just pleased to be on the call, pleased to help any way we can. And between this and upcoming weather, which I'm sure you'll be hearing more about really soon, then we're just staying busy. And with that, I'll turn it over to Robert to give a report.
Thank you, Sheriff. So the Caddo Office of Homeland Security, Caddo Parish Sheriff's Office of Homeland Security right now, we're still with everybody in this COVID-19 kind of fight. So we're trying to actively keep everybody in the loop with the information in regards to COVID-19, of which many of you on this call, we have conversations daily. Had a great presentation from Martha White in concerns with the vaccines. And so we have been charged in this office to reach out to those agencies that have yet to be hit by the tier system and make sure that we have good names and good contact information for those individuals as those tiers open up. And it'll be that way when they open up to the general public as well. we'll lend our assistance in making sure that we accurately document those individuals who would like to get vaccinated as those tiers open up. Obviously, the weather has been very important today, so hopefully most of you should have gotten the weather update email that I had sent out earlier in regards to the winter weather that's heading our way. And the Weather Service does think that we will see some impact this evening with some potential light icing as we move into the morning. And once we drop below freezing, we probably will not come above freezing for several days. So it has the potential to create some problems as we have two other systems, Sunday to Monday, and then Wednesday that will cross our area. And then depending on the model runs, we'll probably see anywhere from 2 to 6 inches of some kind of precipitation, whether that is snow, sleet, hopefully not icing. The light icing for tomorrow morning was the only major icing issue that had been presented to us, but the weather does change, as you all know, hour by hour in our corner of the world. The other big thing that comes across our desk this time of year is the Homeland Security grant structure. As we move into the spring, the federal government will release the amount of money that they give to the states and the local jurisdictions to support Homeland Security operations. We have not seen our total as to what Caddo Parish would receive. Traditionally, it's around $121,000. I don't anticipate that changing this year, and those monies are split between the city of Shreveport and Caddo Parish equally, 50-50, and they support any number of.
Viral.
Say that one more time, sir.
Lynn, you might want to mute yourself, Lynn.
And so those are the main things that we have going on right now. We always have a continuing planning operation. We are entering 2021. So we are in 2021. Our emergency operation plan for the parish has to be renewed by 2022. And so there'll be a big effort from our office to reach out to those agencies within the community to make sure that document is actually a good document, a document that is realistic in the way that we operate and the way that we approach disasters. So those are the main things coming out of our office.
Dr. Wilson, we adopted resolution 56 of 2020, and I had asked at our last meeting what was the status and progress on the threat level assessment for COVID-19. I think, and the author of that legislation, Commissioner Johnson, is on the phone as well.
Yes, sir.
We wanted to have something that would designate what tiers or what levels, and from what it sounds like, listening to Dr. White, we would be going down a tier right about now if we had that assessment of that threat level in place. Can somebody, either you or someone from Homeland Security, give us an update on what's the status of that? How soon can we have that implemented? Because I don't think we was asking anybody to ring any sirens or anything. I think it was just a public notification, but I'm not the author. I don't know what was the intent, but I think it was just a sort of public information, public notification that would allow experts to come together to, similar to what we're doing now, to assess whether that should go up or down. But
Dr. Wilson, I can address it.
Sure, thank you.
Go ahead, sir.
Okay. Basically, once we did pass the ordinance, I then took the ordinance to all the players that would be involved in that ordinance. And we had a meeting. And in that meeting, the major concern that I heard, and Robert, you can jump in if you feel free to, the major concern I heard is that they wanted to be more consistent with what the governor was also doing. So instead of calling it threat level 1, 2, 3, they basically wanted to call it phase 1, 2, and 3, which makes it consistent with what the governor was doing. I also had a color system in there as well. And basically taking that from the original, how the Homeland Security first got set up, they had color scheme. And also, if you look at the weather on any of our news stations, they go by color scheme too. So it seems to be that people will look at, well, they understand red is bad. They know yellow means caution. And so if it's green, it's all good. And so the ordinance now, I revised it. I sent Jeff a copy of the revisions that I did based upon the conversation of the meeting that we had last time. And Jeff, if you would get that out to the commissioners and all to the bodies that need to be a part of this, I would appreciate it. But basically, I just changed the wording from threat level to actually phases and say what each phase actually means. The commission did pass this, so basically just working with the organizations that we had included into the ordinance to help get this out and to help also to enforce it. Basically on law enforcement side, they basically said that it was going to be hard to enforce, but with the what's happening now is that the places like the stores, they're basically saying if you don't come in without a mask, they're going to ask you to leave. If you don't leave, that's trespassing. So now we have something really to enforce is trespassing. So with that, Robert, if you want to add anything to that, let me know.
No, you do. You covered it well.
Okay. Well, Commissioner, and if y'all would let us know what else we may need to do, I think it's something that is definitely needed, is warranted. I was in Austin, Texas this weekend, and I saw a similar sort of notification. Well, I wouldn't say notification. I would say maybe public announcement. It wasn't even a note. It was just a public announcement. And even as you drove on the interstates, their interstate signs had, you know, we're at this level of COVID-19. So I don't think it's anything that is unique to Caddo Parish. It seems to be something that is a practice around the country. And so if we could just, you know, let's work to implement it as just a PSA to our community. And let's all work together to get these things done. And we're all working for the betterment of Caddo Parish. So thank you, Commissioner Johnson, for that. Also, last thing on the Homeland Security update, Robert, Dr. Wilson, and I see Kim Ward here as well.
Mhm.
There's the president put out a memorandum basically discussing. I'm sorry, Commissioner Cawthorn, did you have anything before we leave this particular area?
Yes, I wanted to ask Mr. Jump a question as it relates to the weather.
Oh, go ahead, sure.
Is he there?
Yes, sir.
Yeah, he's here.
Yes, my question is, I know you've mentioned and intimated that we're going to be having some bad weather. Will we be getting any details in terms of exactly when it's going in and what safety or precautionary measures need to be taken? So I see one day on my phone that we're going to get down to like 9 or 10 degrees. Are we getting some warnings from SWEPCO, the gas company, what electricity, the possibility of electricity being out, safety hazards in the street, et cetera, et cetera?
So as for those public utility companies, I can't speak for them, but they traditionally do put out public information announcements. We have every intent to have the information that we get put out through our public information departments for our citizens to prepare for the weather coming.
Okay. So I see. So the information will flow from them out to you, and then you disseminate it to the sources which are your communication channels.
That is true. Well, a lot of the department heads that are also on those weather calls with the Weather Service.
Okay.
We will have those daily now, all the way through probably next Wednesday. And at the end of those calls, I will circulate a brief synopsis of what the Weather Service,
okay,
and that will go to the news media as well. So if that helps you out.
Okay. Thank you very much.
You're welcome.
All right. Thank you, Commissioner Cawthorn. Wanted to just get an update on the FEMA reimbursement pursuant to the presidential memorandum. couple weeks ago, he signed that memorandum and made it retroactive to the beginning of the pandemic. I know we had a lot of expenses that were still left unpaid. And even I would imagine some salary expenses that the state may have said didn't qualify for their CARES Act reimbursement. Can somebody give us an update on where we are as it relates to that?
Well, I can talk about our office portion, the Homeland Security office portion, when it comes to public assistance. And that's what the president had signed. He opened it up for where it was traditionally a 75 to 25 cost reimbursement share from the federal government to local government. And he awarded the state of Louisiana 100% cost reimbursement. So that was a good thing. It is for what they refer to as Category B only, and that is emergency protective measures. And hold on just 1 second, and I'll read what FEMA's definition is of that. It says emergency protective measures are those actions taken by a community before, during, and following a disaster to save lives, protect public health and safety, or eliminate immediate threats of significant damage to improve public and private property throughout cost-effective measures. So there's a lot of things that can qualify as emergency protective measures, and I think it's only as creative as your mind can get. So the next step of where we're at is that I would like to meet with representatives from the parish and the city, and I have talked to Dr. Ward already by email, and we're going to meet in the next or have a conversation sometime next week or the week after it allows him time to gather what damages he has out there. And I will do that with the municipalities within Caddo Parish as well. Once I have an idea, or once we have an idea of how much damage we are looking at, I'll reach out to the state of Louisiana and we'll ask for a preliminary damage assessment to take place. And so then the governor's office of Homeland Security and Emergency Preparedness will assign somebody, and they will, used to be they would physically come to the area, but because of COVID, they pretty much do it all by Zoom now. They'll get in touch with us and they'll start going through what we consider damages, and then they'll say, yes, this qualifies, no, this doesn't qualify. It basically starts the process from there. You are correct, it was backdated to the beginning. The actual date is we can go back to January 20th of 2020 for those type of damages. It does not include any permanent work, and that's category C through G. But I still think that we have quite a bit in that emergency protective measures.
What would permanent work be? Permanent work would be
if we had facilities and stuff damaged from like tornadoes or infrastructure damage, that's that kind of permanent work. Debris removal also comes into permanent work. But right now, it's just category B.
Okay. Well, I think we did quite a bit under public health, and so hopefully we'll do all that we can to qualify for that. And Dr. Wilson, did you have anything on that?
Yeah, I was going to say, Dr. Ward is going to take a look at our list of remaining unreimbursable expenses and compare that list and see what on the list that we can possibly try to get reimbursed for under this program.
Okay. All right. Well, I appreciate that. And we'll go on to the next thing. Mr. Clerk.
All right. The
Does anybody have any questions on this particular section? I'm sorry. All right, Mr. Clerk.
Otherwise, the next item is update on the U.S. Treasury Rental Assistance Program.
Dr. Wilson.
Yes, sir. Okay. We sent out 12 requests for qualification related to the Emergency Assistance Program. The purpose of the RFQ was to determine the level of resources available to develop and implement the program. We received 7 from the 12 requests we sent out. As we're reviewing the RFQ responses, researching similar rental assistance programs, and analyzing the guidelines and requirements for the Emergency Assistance Program, we have determined that the most efficient and expedient method for implementing the program is to use an administrator to manage the overall program while using our community partners to receive and process the applications. The community partners will be compensated for their assistance through an agreed upon compensation method. The following advantages we see in using a combination of administrator and community partners to implement the program is as follows. Given the short time frame we have to implement the program, the quickest method to get the program up and running is to use an administrator who already has the resources and the staff to implement the program relative to this with relative ease. A reliable and accurate and easy to use rental assistance software program is a key component to the successful implementation of this emergency assistance program. A well-established administrator will have the software already developed to administer and receive applications. To access this software would be shared with our community partners. Considering the surrounding of the COVID-19 pandemic and the fear of visiting public offices, an online portal is also necessary for the success of the program, so that an administrator will be allowed to use the online portal process. The data collection and reporting will be a large component of the Emergency Rental Assistance Fund. A well-established administrator can provide information using the rental software on all demographics, income level, status of application, funds committed and spent, and any other data required by funding sources, including the U.S. Treasury. The administrative program administrator will be responsibility would include, but not limited to, the following: develop the guidelines for the program requirements, including documentation, design and application, create an online application portal, create an application and applications in multiple languages, provide a call center and customer support service to assist applicants with questions, provide bilingual support personnel, train community partners to collect data through an online system, establish a quality control process to identify deficiencies and inconsistencies. Our goal is to have the applications process up and running sometime beginning of March. And we also would, we are seeking to have the selection of the administrator by midweek next week to complete our RFQ process.
So Dr. Wilson, let me make sure I understand. The administrator is going to establish a call center?
Yes, sir.
Why would that be the case when 211 already has a call center in place?
Well, you might use that as a means to provide that element.
Well, now, Doc, in the resolution, it already had 211 designated as the call center.
Yeah. Okay. If that's so, we will endeavor to make
Yeah,
sure.
I don't want us to adopt something and then some administrator that y'all hire comes in and tries to completely rework that. That was not the intention or the spirit of the resolution.
Mm-hmm. Yeah. If the 211 center would suffice, I think that would be something that will be considered.
And who the administrator is going to select the organization?
No, sir.
So who are the organizations? Well, who are the organizations that received the RFQ, and who are the organizations that are being selected, community partners that are being selected?
Okay, we sent out 12. I don't have the list before me. Ms. Haley, do you have the list before you?
I have a listing. Yes, sir. Just give me.
We can't hear you, Haley.
Please speak up.
Can you hear me now?
Yes, ma'am.
Okay. I can tell you real quick. Hold on. Okay, we sent out RFQs 12. I want to give you the list of people that responded. United Way responded, Providence House responded, Northwest CDC, Grace Project, Catholic Charities, Postal Wake Netterville, and the Housing Authority of City of Shreveport. They all responded. We did not receive responses from Goodwill Industries, from a company by the name of CSRS. I'm going off memory now, so give me a second.
Mhm.
Who else did we send them to? CCAA did not respond.
Mhm.
And let's see. Morning Star Baptist Church did not respond.
Okay. Okay, thank you, Ms. Haley. Commissioner Jackson, answer to your question, we will be selecting the community partners.
Okay, because I've never heard of PNR, Post-Base Newterville, doing rental assistance. Or are they-
Wade and Etterville reached out to us inquiring about the program because they were successful with working with the state of Louisiana with the Main Street, what was it called? Main Street Recovery Efforts. And they also did some rental assistance work with the state. So they just sent in a request for they asked to send in a request for qualifications.
I think some things are going to come out pretty soon about the level of fraud that was in the Main Street program. So if that's the carrot or if that's the car that they're trying to drive in on, it's not a good one. I just, but that's good to hear that y'all are moving forward with that. There's clearly some more dollars that will be coming down. Who was CSRC or?
It was CSRS.
CSRS.
They are, they're out of Texas. When this all came out, we just were not inundated, but we had several companies reach out wanting to participate. And they were just one of the ones that reached out. And so if a company reached out to us, then when we sent the letters out, we sent them one too. But they didn't respond. So they are working with the state to implement the 57 parish funding for the emergency rental assistance. They got the state contract to do their work. So we're thinking that's the reason why they weren't interested in us, because they'll be with the state.
Gotcha. So Goodwill, CSRS, and CCAA didn't respond.
And Morning Star Baptist Church.
Morningstar. Okay, gotcha. Thank you. Okay. Well, Doc, I think y'all got your hands full with it. Did y'all ever come to a determination on whether y'all were going to separate out the state portion or the direct assistance, the direct allocation that we received? How is that gonna?
Yeah, we're still thinking about that approach, but we did talk about tracking it separately in our accounting process.
Okay, because the guidelines that the state set forth is for the state allocation. And have they indicated? I saw New Orleans got 14 million of that. Have they indicated the dollar amount?
No, so we're supposed to be meeting with them with the attorney from the state board tomorrow.
Okay.
Is that correct, Haley?
We've been given our amount. It's about 8.1 million.
Okay.
That we're going to be getting from the state. So our total for the rental assistance will be a little over 15 million for the Caddo Parish alone.
But that 8 million has priority for that LaReap. Is that my understanding?
That's right. And I've been given, they've given me the number of applications that they have already received for that, and the breakdown of those that have been disqualified, the breakdown that have been approved, but payment wasn't made. So I already have that breakdown. And with the 8.1 million, those applications do get first priority on that.
On the
8 million, not the 7. Yeah.
Okay. All right. Okay. And Dr. Wilson, there was I don't know if you saw that about how they're going to calculate the dollar amount for rent. There has been some change in that. And I don't know if y'all saw that. If not, I'll shoot it to you.
Okay.
Somebody sent something about how we're going to collect AMIs. And I had to tell her that the parish doesn't set the AMI.
Yeah, that's correct.
That's set at the treasury level. And so the treasury has at least put out what they consider the dollar amount for that. So, okay. All right.
Okay, that's it.
And did you get a chance to talk to Ms. Bonnie Moore?
Yes, sir. Yes, sir, I did.
Okay.
Eric and I, we had a conference call with her earlier today.
Okay, great. All right. Any committee members have anything on this particular item or issue? All right. All right. I don't see any. Mr. Clerk, next.
All right, that brings us to the discussion regarding the MPC ZBA teleconference meeting.
Yes, sir. Commissioner Epperson.
Yes, sir. Mr. Chairman and committee members, the Metropolitan Planning Commission did have a virtual MPC meeting on February the 3rd. Went quite well and quite smooth. Also, they are scheduling the upcoming ZBA meeting, I think on the 17th virtually. So hopefully they will continue that in light of the 25,000 in which I think Mr. Chavez was the one that made the motion for that ordinance, was to ensure the safety of the MPC staff and applicants. And I certainly would consider we spending parish money to make sure that includes the safety of our citizens too, the same as we are. And however, I think on last count, it did not make the cut for the reimbursement at this time. However, based upon what I heard from Mr. Jump relative to this situation, we could go back and we could recoup our 25,000 under that because it is for public safety. Am I correct?
Yes, sir. That's what he said.
Okay, so at this point in time, I'm good on that item that I had on the agenda.
Okay. All right. Well, if I hear no other questions, is there a motion to adjourn?
So move.
All right. Moved by Commissioner Epperson. Is there any objection to adjournment? Hear no objection, the meeting is adjourned. Thank you, everybody. Be safe. Have a good one.